The first one is what we call drug of choice, and it's the corticosteroids. Corticosteroids, my easy way to remember it is anything that ends in "-one" is some kind of steroid. So corticosteroids, cortisone shots. In this case, we would talk about fluticasone, which is a nasal spray. I believe that's found as a component in Flonase, and it's also a part of your Advair. And you have beclomethasone. So you have a list of drugs that end with "-one that are used as anti-inflammatories for the airways as well as other parts of the body. Depends on what drug that you're talking about. So corticosteroids, fluticasone. One of the side effects you have to remember is that it can cause brittle bones. So the use of corticosteroids, cortisol-like medications, is that you have to watch out for osteoporosis, brittle bones that could occur with the use of corticosteroids. So that's number one. Second one, we call these leukotriene modulators. Leukotriene modulators. I'm going to put a negative sign and circle it. So we're going to say leukotriene inhibitors, even though they call it modulators, which means it's an antagonist. It inhibits leukotrienes. What do we care about for leukotrienes? Well, leukotrienes are a part of the inflammatory response. So when you release leukotrienes, it acts in relation to inflammation, heat, redness, pain, and swelling. So if I was to block this, right, the same way that I can use aspirin to block inflammation, if I block this using something called Accolate as the brand name, so I'm going to use Accolate as the brand name, and the generic name is so fun to say, Zafirlukast. I can't even say it right. Furlucast. Okay, Zafirlukast. Accolate is a leukotriene inhibitor that reduces inflammation and helps to deal and manage with the inflammation associated with this dysfunction. Okay, so that's the second one. The third one,